Hi, I'm Dr.Santosh Joshi and we run Dr.Joshis Center for Autism in Mumbai. We also have a full-fledged online practice where we support patients from all over the world. We provide homeopathy, nutrition and therapies to children suffering from autism spectrum disorder. We have been working in this space for the past decade, and what we are seeing is that the trend of autism is increasing day by day. Earlier, we used to have patients from US and Europe a lot, but these days we see a lot of kids from India, and that is across India, not only from any specific state, but we see patients from all over the states of India. Autism is a neurodevelopmental disorder where we see the children suffering from autism cannot interact socially. There are a lot of sensory issues where they cannot deal with the normal inputs to the body. Some kids are sensitive to cutting the hair, brush the teeth, and a lot of other things are seen. So it's a disorder, but it's not a disease per se. Actually, what happens when the child is around the age of 2 years or before that, after 1.5 years of age, the parents start seeing certain symptoms like the child is not speaking, the child suddenly stops to talk, whatever words he was talking or she was talking, and there are a lot of issues like hyperactivity. The child doesn't sit in one place, keeps on running from one corridor to the another. Then the child doesn't talk, the child doesn't follow commands. If you tell him simple commands, the child cannot follow it. So these are the times when the parent feels there is some problem. Another important aspect is the child is lost within himself and the child doesn't play with the peer group as in the small kids. So these are alarming signs of autism when parents do feel there is something wrong with the child, and then they consult their doctor. When we say the child is lost, that means the child is lost within his own world. Like when the child, if he's playing and if you tell him, get this thing, the child doesn't look at you or doesn't respond. And there's no eye contact. As we talk, we have eye contact with the kids, the child will not respond to any of the commands and will not give eye contact. And they're just lost within themselves. That is one of the important characteristics of autism. It was like following the commands, like one-step commands, two-step commands, and complex commands. At Dr. Joshis Center for Autism, when a parent comes with a child to us, we try to establish a diagnosis by running the assessment tests, which are done by a clinical psychologist or by a developmental pediatrician. Once the diagnosis is established, we try to make a goal or a plan for the child. So we tell the parent that the child has to undergo therapies, take homeopathic treatment as well as nutritional intervention. When it comes to treatment of the child, homeopathy plays a critical role because when we give homeopathy to the child, we can establish the things like improving the comprehension of the child, improving the interaction capabilities of the child, reducing the sensory issues, and help the child to develop overall. Whereas therapies will play its own role, but if the child is hyperactive and the child is not sitting in one place, giving a therapy is not possible, or it is very difficult to give a therapy. So what homeopathy can do is help the child to calm down and focus more. So the therapy can be applied in a better way. This overall integrated approach we take at Dr. Joshis Center for Autism. We have first step is the assessment, second step is chalking out a plan for the child, and then implementing. So implementation will be homeopathy, nutrition and therapies, all things together. But therapies will be given as per the requirement of the child. When we say if the child is mildly autistic, or if the child is in the range of mild to moderate and moderate to severe, and some kids are severely autistic. So the therapy depends on the level of autism or how bad the autism is. The hope factor is that we tell the parent that we should work with the child to bring out the best capabilities out of the child, not to think, are we going to cure the disorder or is the child going to get all right? Our focus is to make the child independent, because we know these kids have some specific capabilities which are outstanding, which are not normally seen in individuals. So we should think we should search for those things which are gifted to the child and work on them. And if the child is under the age of 5 years, the chances of improvement are tremendous. That's what we have seen for the past 10 years when we are treating kids. But as the age develops, the response to therapies as well as treatment is little slower. But that doesn't mean that the child is not going to improve. And we have seen certain kids getting over these issues completely, and they're going into the mainstream, going to normal school, taking prizes in their school. So the hope is there, but the important aspect is to work with the child and give the things like therapies, homeopathy, nutrition properly. Not to say, oh, this is not going to help, this is not going to help, but work together with your treating team and see what best can be achieved. That's a good question. Yes, a lot of people go to allopathic side when they diagnose any disease, but in allopathy right now, as per the research, there are very few remedies which could help the child to calm down. But there's nothing which could help the child in the long run without any side effects. Here, homeopathy comes into play because homeopathy works in this area and has no side effects. Homeopathy goes to the depth of the problem and can help the child in improving the comprehension, reducing the sensory issues, and helping the child develop overall, and that too without complicating the things at the physiological level, as in not creating any side effects. And children can easily take the medicine because it is sweet to taste, so there is no problem of giving the medicine. And when we see, when homeopathy is given, when the child is undergoing a therapy and all, we see that the child focuses more, the child can concentrate more. So these areas can be developed very easily with the treatment. But one of the important aspects in homeopathy is that you have to be regular, you have to tell a proper feedback. Like if there's any improvement in the child, you have to tell. If there's no improvement, you have to tell there's no improvement, because the assessment is very important, because the remedies have to be found out which suit the individual. Because in homeopathy, it is an individualized treatment. When we see 10 autistic kids, the remedies might be different for all the 10 autistic kids, because it is a customized, individualized form of treatment. So what you observe is characteristics in the child that has to be told to your treating doctor or treating homeopath, so that he can find the right remedy that suits the individual. So once you give the right remedy, we have to see what effect that remedy causes. So you have to keep a logbook and keep a note what all changes you find in the child, so that if you are able to do that, the next step becomes very easy to find a remedy that complements the first step. So it is a complete process which have to follow. So we have to work as a team. So that is very important. You have to be open with your homeopath and give proper follow-ups if you want to achieve the result in the long run. Autism spectrum disorder is growing at an alarming level. It is worldwide. Right now, as per the statistic, 1% of total population of the world is suffering from autism, which is at a very bigger level. If you see in US, 1 in 68 child is an autistic kid, and autism is 5 times more prevalent in boys than in girls. That is in US. But when you look at India, as per the epidemiological studies which are not being done in India, a rough estimate is around 2 million kids suffer from autism in India itself, and it is growing at an alarming rate. Now, what contributes to autism is a bigger question, because the research is still going on. The latest research says that due to some chemical imbalance in the brain, the autism symptoms are driven, but that still is under the research base. So it is a big problem. It is like an epidemic which is going on, but not much is being done about the awareness of autism. When it comes to India, still educated class ask us, when we tell them we are running a campaign on autism, they do come and ask, what is autism? Ideally, we expect educated people to know these things, but still lots has to be done to create awareness about autism. When the parent realizes there's some problem with the kid, they do have a query, is the child having some problem when the child doesn't do the things which is supposed to do. Then the first step that the parent takes is go to internet and search for these symptoms, and then they get a vague idea ki, is it autism or is it something else? Then the fear factor creeps in, and they are really in a panic mode, what to do, what not to do. Then sometimes when they go to a doctor or a physician or anybody, means any medical person, in India the problem is that sometimes it has been like, oh, the child will speak after some time, but there is a tendency that the other minor symptoms of autism are neglected, because why we are saying is this early intervention is very important. So even a slightest symptom, when you are in doubt, you should go to a developmental pediatrician or a center, autism center, to see if the child is having autism or no, because it's a major diagnosis to be made. And once the diagnosis is made, the other important aspect is acceptance. The parents have to accept it. Because what we see, parents do not accept that the child is having autism. They try to think, oh no, this is not autism, this happens in kids, the child will get over it. And the precious time is lost in that phase. If you lose 6 months to 1 year, that's a critical time that we are losing in the 5 years, below 5 years age of kids. So that's why they should go and do the diagnosis and accept it. If a psychological counseling is needed for the parents, they should get that counseling, because parents will play a critical role in handling the kid. If you just study the 100 kids, if for a statistical record we are checking of the last 100 kids we treated for autism, we saw quite positive changes in the child. Some of the important areas where the child improved was eye contact, command following, reduction in hyperactivity, which is a major issue, reduction in sensory issues, and the child starts to respond. And what we have seen in these kids, that within the first 1 month, we were able to find some changes in the child. They are not very big changes, but some minute changes which the parent observed and appreciated. What they are trying for so many months, which has not happened, has happened after starting the treatment. So if the question comes, does homeopathy really work? Then this is the answer to it. Yes, homeopathy really works, because when everything else was tried, even giving medicines which would make the child calm down and all those things, but still the child was not responding. But when they started homeopathy, they could see these changes, and the parent themselves have come and told, we are not forcing somebody to give a testimonial or something, but it was from their side what was observed. So yes, homeopathy can really work in these kids. And we have seen kids who are under the 5 years of age respond very fast, and the amount of improvement that we have seen is tremendous. In our practice, we have seen few kids who have completely got over it. That's what their pediatrician told us, and they are going to normal school, doing the normal stuff. And it's fantastic to know that we could make some change to anybody's life with homeopathy. So yes, homeopathy has a very important role to play. We have seen no side effects as such till date, and homeopathy is completely safe unless it is abused. Like people say anybody can give homeopathy. Now if you give the wrong remedy to the child is not going to improve. So there's no side effect, but it has to be practiced in the right way. That's where the expertise comes in. And you should know how to handle autistic kids, because you should have a lot of patience when they come to your consultation or when you're working with their families. We have to understand the emotional turmoil that the family is going through. Not just say, oh, I'm a big doctor, I don't have time. If you don't have time, then I think it's not the right area to get into. Means you should have time to work with autistic kids and their families. That's what we believe in. At Dr. Joshi's Center for Autism, what we have done, that we have taken the help of technology. We have been working in the space of technology since the .com boom in 2000, where we had thought there should be something called as telemedicine, which can be actually implemented, and that dream, we could say, we have seen it come through with the technological advances that have come. And now currently we are quite amazed with the use of WhatsApp, even in rural India, where we are worried how we are going to reach out to these people, where internet is not that fast. How can we get the video clippings and all those things? At that time the patient tells us, sir, can we send it via WhatsApp? Is it okay with you? Or can we use that other application which we can have a video chat directly on the phone? So these technological advances have really helped us in reaching out to these people who could otherwise not come to our center. And in remote areas of rural India, where very few therapy centers are there, if at all, and there's nothing called as therapy for these kids, and what they could do, because therapy also forms an important aspect as well as homeopathic treatment. So we are working on an online therapy protocol where we could give online therapies to the kids, and we have started for speech therapy. We have actually implemented it, and we give speech therapy online to these people who cannot come. And when the case of homeopathy comes, we are doing it since last 10 years successfully. We send medicines across India in the remotest part. We have patients from Kanyakumari till Sikkim, and if you compare other spectrum is from Assam, and we have from Bhubaneswar, in Mumbai, Gujarat. So pan-India we have got everywhere, and we had certain patients who came from very deep pockets of the world also. So technological advances have really helped us in reaching out to the people. The last message would be that we should promote awareness, which is lacking throughout. If you see globally, there is lack of awareness, and there are lots of misconceptions about homeopathy, that homeopathy is a witchcraft, homeopathy is a placebo effect, homeopathy is this, homeopathy is that. But why do we get into all those things when we can see the results which can be achieved without any side effects? Maybe it is a placebo, but then it is bringing a positive change in the child. So why not accept it? Or why just say, no, homeopathy doesn't work, it's of no use? That's not right. Means we believe that awareness has to be built in, and that has to go from the medical fraternity towards the public, not the other way around, because here our patients defend for us. When somebody says homeopathy doesn't work, the patient themselves revolt. They say, no, we have seen the results.